Welcome, Isabel, to our Digitising Europe Summit, and thank you so much for taking a little bit of your time to answer a few questions.
Sure, anytime.
My first question is, Immersive Rehab uses virtual reality to improve the effectiveness of physical and neuro rehabilitation. How accepted is that concept regarding the end consumer? Have you had any challenges to introduce your technologies to the people and patients that actually have to use it?
Yeah, so far I've only worked with patients on a voluntary basis because we're still going through regulatory approvals. But the patients I've worked with, which were about 30 to 40 patients in total, and physios and therapists equally, it was actually quite easy. I have to say, they were maybe initially because they had never used VR, virtual reality before, which is still quite a big part of the population, I have to say. They were kind of interested in how the technology worked and kind of exploring, and maybe some were a bit skeptical about, because most people I worked with were in the acute wards, so they had just had their stroke or just had a spinal cord injury, for example. And so obviously for them, they're already in a very highly stressed state, both also mentally as well. It's a very hard state too. But then when they were trying it and after explaining how it worked, and then when the physio actually also did a session with them, they kind of blossomed open because people that I worked with, and I'll never forget that, and it's kind of what was pushing me forward, is this one man coming in, and it's like in a wheelchair, so he just had a stroke, and I don't know if I want to do this, but you could tell from his face he didn't say that, but it's because the physio asked me, so I'll just do it, I guess. But then when he was doing it, he was going from a very down person. He was laughing with the physio as well, as you could tell that their relationship initially was very there was some friction, I guess. But actually, when they were doing it, and that was very positive to see. And then afterwards, he was asking, he had also speech impairment. He was asking, when is it available? Can we use it? And so that's kind of what keeps me going every day as well. So, yeah.
In the health sector, because we just published a tech divide study that was quoted several times during the day, there was also one question about if people would prefer to be operated by an uneducated friend or a robot that has been specifically designed to do the operation. And I don't remember the exact number, but most of the participants said, not a robot, I would actually prefer the friend to cut me open and do whatever. Is the health sector a special sector where you observe lots of hesitance, lots of concerns, be it security concerns, privacy concerns?
Yeah, absolutely. And I think that's justified as well. To most, you're dealing with patients' lives, and the patient outcome is the most important outcome. And that's for nurses, clinicians, for us, for anyone really that works in the healthcare space, that should be the most important thing. And obviously, when introducing a new technology in a space that has never been used in healthcare really, and there's very few evidence that it works, let's say, because there's no really long-term studies to prove it, which we are working on at this point, to really show in quantitative ways the outcome. We've seen it qualitatively, but we want to show it in numbers as well, what it can really bring. And I think that's what's really important for clinicians, but also for the people purchasing it in the hospitals, is to really show them this is really what the impact can be on patients' outcome, but also in the hospital. We can make physios, for example, work more efficiently in some ways. They can maybe treat very severe patients, and then someone that is maybe assisting the physios in some way, or can actually take over one of their patients using virtual reality when they've kind of evolved a bit more already, that they can do it themselves. The physio would not actually have to be there. We're not at all replacing a physio. That's one that is really an important aspect as well. And that is sometimes maybe, but all physios that I've worked with, they were actually very open to it. They really saw the potential. They suddenly were able to, they expressed that they suddenly would be able to do lots of exercises, upper limb then, that they actually are not able to do today, which could then help patients. So, but I think a lot is about, communicating it well, being open to having a discussion, and also obviously showing what it actually brings to patients. I don't want to make anything that really is a negative effect has a negative effect on patients' outcome because they're already going through such a hard experience themselves. So we really want to help enhance their care that they already are receiving from the physios and the clinicians.
So this leads a little bit to my next question, because in the health sector, the people are very keen to have human interaction and go to the doctor and have a very personal relationship. And do you think, if you, not only from your point of view, from your startup, but general, do you think that in the health sector in the future we will have less human interaction and more human robot? And is there a replacement of doctors, of therapists, of physios? What do you think?
I don't think so, actually. Maybe in some aspects, but I think in a lot of aspects, because when you create management systems, for example, patient management systems, there are hospital systems that suddenly take away, help doctors, nurses work in a much more efficient way. Instead of spending 10 hours on admin, maybe they can just do it in 1 hour. Because there are systems that actually helps them to maintain things much better. They can transfer data from one place, one clinician to the next in a much more efficient way. So I think there will actually be more time for clinicians to actually spend quality time with their patients, where now actually you have to say, oh, I only have 10 minutes because the other 10 minutes I have to actually spend on transferring all these data and so on. And if we can automate that, then obviously they actually have more time to spend with patients. So I think it won't, in my view, and I guess that's also possibly a hope, but I think it will actually be beneficial for human doctor-patient interaction. And also doctors will be now, like doctors, nurses, healthcare professionals, they're working in very stressful conditions. One, because they have lack of time, because they have to deal with all this paperwork next to actually working with the patients themselves. And if we can take away that burden on them by reducing that amount of time that they spend on that, it might help with the stressful situations as well, because they might have then more time to actually deal with serious cases that they want to deal with, dealing with patient, doctor, or patient healthcare professional relationship as well. So,
coming from an entrepreneurial view and perspective, the summit today is called Digitising Europe Summit, and we have heard, I think, 100 times that the top 10 tech ventures are coming from the Silicon Valley, not from Europe. You have a European tech venture now. You found your own company. What do you see specific advantages of being a European startup, and do you see also specific disadvantages where you say, okay, Europe really has to catch up because otherwise I really have bureaucratic burden or whatever that actually holds you back?
I think, being based in Europe, I think access to setting up a startup is obviously it's easy. The good thing is, everything in Europe is so well connected. So to be able to reach out to other countries, for example, in the healthcare sector, I'm in touch with hospitals around Europe as well. There's no real boundaries, so I think that's really a benefit. Then, the skills in Europe. I studied engineering in Europe, both in Belgium and in Sweden, and the quality of education is really, really high. So I think having that talent pool of people as well in Europe that are also willing to move, because in Europe mobility is very flexible in a way. I lived in many countries around Europe myself, working. And that is a very positive thing as well. So I think that is a negative thing, I guess, is in terms of funding maybe. I think when comparing it with Silicon Valley, for example, the access to funding, or they're less risk averse. Let's keep it to that. And in Europe, we're much more risk averse, and that makes kind of the progress maybe in certain areas not as fast, or it could go faster because you don't have the access to the same funding as where, especially, and then I'm talking about seed funding. So when it's in the initial stages, if you have that access, that funding in the US, you might be able to go a lot quicker than when in Europe. You might have to look into grants, but then grants often take about 2 years maybe or longer to actually complete it, but it actually, and that's also a limited amount of money. So to help you scale, I think, or give that initial boost to the business, I think there might be some things that need to kind of improve maybe going forward. But I think we have a very strong social grounding here in Europe, which is different in other countries outside of Europe, and I think that's very beneficial for healthcare. We have great healthcare systems around Europe, and that is really kind of the values are there, and I think that really helps my startup to work within that ecosystem, and that makes it really great as well. So
that leads to my last question. I always ask this last question to our speakers. If you would have one wish, what is the greatest wish you have for the future of Europe?
I think one would be like a more unified healthcare system. I think that would be very beneficial. We've seen it now coming with the prescription medicine, the e-health kind of transfer between countries. So I think it's only 2 countries now in the European Union that are doing it, but if you get a prescription, let's say here, you can actually go to France very easily. It could be transferred without any issues, really. You can just, and I think that's only the start of what really could become a more unified healthcare system, where, especially with mobility in Europe as well, myself, I've experienced many different healthcare systems in Europe while living in the different countries, and I think there are still issues, because if you go, it would be really great to have a system where it would be really much easier to have access to certain things when you go and live in another country, for example, so I think there could be that would be really great in terms of getting to a more unified healthcare system in Europe. That is also, and then I'm talking also about reimbursement plans, basically, that if you move for work to another country as well, that now you have the European card, and definitely that's a really great incentive, or like offer to the EU citizens, and it really is very helpful, because if you get sick abroad and so on, but I think that could definitely be expanded. The card is only a minor thing of what healthcare could be for Europe, and as I mentioned in my talk as well, I will not be able to solve the healthcare problem on my own, unfortunately, and I think it's very much a collective effort, whether it's nationally, but hopefully then pan-European wide, so that we can actually just offer people the healthcare that they need, whether it's originally comes from a startup or a company in Sweden and is treating a patient in Spain, that it just becomes really kind of a natural thing and to put reimbursement plans in place as well, so that people get access at an affordable price as well, or free even, so that it's part of just the normal offer that is given to patients when they need it. And I think, just patient care is the most important thing. So improving patient outcomes across Europe is the most important thing, I think, as well. So having that a bit higher on the European agenda, I think, would be really great.
That sounds like a good plan.
Yeah.
Thank you so much for your time.
Sure.
Thanks for being here. Thanks for your speech you held a few seconds ago. Yeah. And I hope that you have a nice end of the conference and a nice evening here in Berlin.
Thank you so much. Nice talking to you.
Thank you.
Bye.